Hi, I'm Bentley Graves. I'm the Director of Healthcare and Transportation Policy at the Minnesota Chamber of Commerce. And as we're gearing up for the 2023 session, I wanted to share just a few thoughts about the role that health policy is going to play in our advocacy at the Capitol this session. And we know from our 2023 benchmarks report that affordability of healthcare benefits is becoming a greater and greater concern, both for employers and for their employees. In 2023's report, we saw that the average cost of employer-sponsored individual coverage is almost $7,500. And that's a huge jump from last year's number. We now rank 19 highest in the country. Last year, we were near the bottom of the list. We were 38, so we were sitting pretty good. But we know year in, year out, as different comparative reports come out about healthcare costs nationally, that Minnesota ranks near the top in underlying healthcare costs year in, year out. And that causes all sorts of challenges for employers who are struggling to offer their employees competitive benefits in a very, very tight labor market. And as we all know, health insurance and health coverage benefits are some of the most important benefits an employer can offer. But as I said, it's becoming harder and harder. So there's a couple of things we want to do at the Capitol this session, one of which is work with the state legislature to try not to make the affordability concerns any worse. Minnesota already requires coverage of more things in the insurance products that you buy in this state than virtually any other state. And our ask, frankly, to the legislature is simply not to make that any worse. We, over the last couple of years, set up a new system where anytime a legislator or policymaker comes with an idea to the legislature about adding to that already very long list with new coverage requirements, that go through a cost-benefit analysis at the Department of Commerce to help us all understand what the trade-offs are associated with these things. They all benefit somebody, but they all come with some cost. So now this process is up and running at the Department of Commerce, this mandate review process to help us understand the cost and benefit of these proposals. We think that if there's a proposal that goes through that comes out of that process with verifiable impact on cost of premiums and impact on premiums, that's a cost that the state should pick up. If the legislature determines that there are policy reasons for adding to our already very long list of coverages, that's fine. That's a decision that they make from a policy perspective, but it's also something that we think the state then should pick up the tab for and not pass it on to premium payers who, as we've already said, are struggling along with employers to make the cost equation work in healthcare. One of the other pieces we want to make sure we keep an eye on is the ability of self-funded employers to manage the benefits in a way that works for them and their employees. Self-funded employers are governed under federal law, under ERISA. But increasingly, states are looking for ways to reach into these federally regulated plans and bring state statute and state regulation into the mix as well. This not only creates a whole bunch of problems from particularly large employers that are managing employee benefits that's across states, but also takes away some of the flexibility that these employers have to design benefits and offerings that work for them and their employees. So this is another place where we'll be looking to kind of hold the tide on the flexibility that employers have to design benefits that work for them and their employees and to meet the demands that they have from a cost and affordability standpoint. What we're likely to see, however, is a push at the Capitol to try and address the affordability issues within healthcare by having the government do more. There will likely be a push for the state to set up some sort of state-sponsored health insurance option, or to let anybody from any income level buy into our public programs like Minnesota Care and Medicaid. And while these are certainly well-intentioned and again have the goal of trying to solve the affordability problem in healthcare that many Minnesotans are facing, it will just make the problem worse, likely, for those that are in the commercial market, because these programs, these public programs, pay providers much, much less than what commercial insured patients do. And so the more and more folks we have coming through the door of the doctor's office paying less than cost, the more and more of that cost is going to be shifted onto those with commercial insurance. Additionally, what's going to happen likely is we'll see providers, particularly in greater Minnesota, start to pull back on services. Again, if they have more and more patients coming through the door, paying at a rate that doesn't cover their costs, they're going to be forced to pare back services. And it's going to create even more significant access issues, particularly out in greater Minnesota. And again, that will have an impact both on employers and employees. And so that's a conversation that is likely coming. That's something that we're going to continue to raise concerns about and look for other ways to work with the legislature to address the affordability concerns that our members and their employees have without making the problem worse. Again, these are just some of the things that we expect to be working on this session. I'm sure there'll be a lot of other issues raised. If you have any questions about these issues or any other healthcare related issues that you see popping up in the news, or that pop up in your conversations with your HR folks, your benefits professionals that we can help with, please reach out. You can find me at bgraves@mnchamber.com. You can find my information on the website. Look forward to hearing from you. Thank you for your support of the chamber. Thank you for your engagement in the chamber. We'll look forward to hearing from you as the session goes on.